Okay, symptom and process, specific psychological disorder. So, some psychological disorder can be shown through symptoms. So, symptom and process may or will impair work performance if person works. So, this indicate that if the individual who experience psychological disorder, if they are employees or if they work in the organizations, the psychological disorder that they experience may impair their work performance. So, stress and psychological factor and health problems such as adjustment reactions, stress disorder that they experience, or psychological factors leading to physical reactions. So, there are many different factors. For example, adjustment disorders usually will manifest after a time as a result of specific stressors such as starting new jobs. So there are many psychological problems such as adjustment disorder. Adjustment disorder is related to how people adjust to the new situation. For example, if new employees just been hired, so how these employees adjust or adapt to the new environment, new working environment. So if these employees be able to adjust properly, I means well, so they will experience good adjustment. If not, these employees will experience adjustment disorder. And stress disorder are related to acute and chronic stress and life change. These lead to various stress-related illnesses such as cold, flu, and so on. So, as you all know, that stress that's mentioned in this textbook divided into two: acute and chronic stress, and also it's not only two; it's three: acute and chronic stresses and life changes. So, this stress disorder will lead to physical health illnesses. And relationship between psychological factor and physical illnesses also can happen because of those psychological problems such as headaches, cardiovascular disease, asthma, and cancer. So we cannot say that if anyone who experience psychological problems is just having a mental problems. Actually, those who having a mental problem or psychological problem can also have effects on their physical health. That means those who experience a psychological problem will also negatively affects on their physical or physiological health, such as they will experience some sickness or illnesses, such as they may experience headaches, having cardiovascular systems such as blood pressure and so on, asthma and cancer. So when we talk about anxiety-based disorder, there are many different types of psychological disorders, such as anxiety-based disorders. These various disorders characterized by fear, panics, and anxiety. So when we talk about anxiety-based disorders, so these involve three things: fear, panic, and anxiety. So there are many different kind of anxiety disorder. For example, here you can see generalized anxiety. So when we talk about generalized anxiety, is the anxiety that's considered generalized. So any anxiety such as chronic and undefined intense anxiety. So we talks about generalized because it's undefined, intense anxiety because it's considered part of disorder. Phobic disorder is related more to the persistent fear reactions in specific situations. So this one is generalized anxiety. This one is more specific fear reaction to specific situation. For example, fear for certain animal. Some people fear for example, for spiders, for snakes, rats, and so on. So this phobic disorder is specific situations, reactions of fear, such as fear for certain animal, germs, blood, and so on. Panic disorder is related to unexpected, recurrent and intense anxiety attacks, such as in the public place. So those people who experience panic disorder, sometimes this kind of panic happen unexpectedly, do not know when this panic will attacks. So those panic disorder do not know the times when this panic will attack the individual, and it is recurrent. That means it will happen again and again, and it can be intense. Anxiety attacks can happen in the public places or in the other places. And next is obsessive compulsive disorder. It's also recurrent unwanted thoughts. That means this recurrent happen again and again as something that is unwanted. So this what we call obsessions. So obsessions here, that means always happen. They are obsessed, or they are kind of obsessed to this kind of feeling, to the thoughts. For example, maybe they think that their hand is not really clean enough, so they wash and they scrub it until it is until it become hurt, it become painful. So they are so obsessed with something. For example, if like I mentioned, if they think that their hand is not clean, so they wash and they scrub until their hand become hurt. And also when those who experience obsessive compulsive, also, for example, there's for example, they sometimes forget, or maybe when someone forget, when they want to go out, and then they forget that they whether they turn on or turn off, or whether they turn off the for example the lights or not. So they go and check again and come back again and check again and come back again many times. So this kind of obsessive compulsive is recurrent. I mentioned here, they obsessed with the behavior, and it's senseless. Also, it's a senseless urge and ritual, so it's a compulsion. So they obsess, and this are following with the ritual and urge. So for example, I mentioned here washing their hand 100 times, even though they already wash, they know already wash, but because they think that it's still not clean. And then when they want to go out, and then again they will go check again whether they turn off the lights or not, and they go check again. So they kind of this considered as obsessive compulsive disorder. Another is acute stress disorder. So acute, remember I mentioned acute happens suddenly. So this intense maladaptive anxiety reaction immediately after a traumatic event. So this happened immediately after the event, after the traumatic event has occurred. So post-traumatic stress disorder, this one is a prolonged anxiety reactions related to repeated experience of previous traumatic event. So this that's why it said post-traumatic stress disorder. That means the stress happened after the events. This one immediately after the event. This post-traumatic disorder happen is a reactions, anxiety reactions related to the experience, normally happens after the traumatic events, such as car accidents. That's why after the car accidents you may have some traumatic stress disorder, where you cannot drive your car anymore, or maybe it takes time for you to go back behind the wheel after the accidents. So that's considered post-traumatic stress disorder. Schizophrenia and other psychotic disorders. Schizophrenia is more serious, because if you experience this one, you become more or less like a crazy people or psychotic individual. So schizophrenia is a serious distortions. That means they cannot differentiate between reality and fantasy. They see things in different kind of shapes. So this is very serious. So normally people will put maybe people who experience this need to be given some therapies, given medicines, and then may puts in the special place, so that it will not hurt themselves or hurt others. So serious distortions in all spheres of human functioning, including thought, speech, perception, emotion, and even physical functioning. So those those who have this schizophrenia, they may experience delusions. That means false belief which are maintained even if unrealistic. So they believe in something that is not true. It's kind of delusions. Even they know that it is unrealistic, but they still strongly believe about the thing. For example, they believe about the existence of other of themselves, or the second being of themselves. For example, hallucinations is regarding the sensory distorted perceptions such as sound or smell in the absence of such real stimuli. So hallucination uh, is a kind of distorted perception where they perceive or they smell or they hear something that is actually not real. For example, they smell something good, something bad, but other people around them didn't smell, or they hear something scary or something nice like a music, someone singing, someone laughing, but other people, normal people, didn't hear the sound that they hear. So this kind of hallucination is their sensory distorted perception, but actually it's not exist. Another is when we talk about problems in terms of physical, psychological disorder, is because of the substance abuse and dependence. So those who used to take drugs or alcohol or other substances may experience some problem like hallucinations, delusions because of the drugs effects, or because of the drugs what we call it, because of the influence of the drugs or influence of the alcohol. That's why people who drink alcohol, after some time, they cannot know whether they speak to the pillars, they speak to the pool, or they speak to the car, because they have this kind of problem. And those drug addicts also, sometimes they have a problem talking to themselves, talking to the stone, and so on. So this kind of abuse of this alcohol and drugs, or dependence on this, can actually lead to psychological problem, mental issues, hallucination, delusions, and so on. Other disorder that people may experience, such as eating disorders, because of want to look good, attractive, they may have eating disorder, or eating disorder maybe because of other reason. And sleep disorder, and disorder regarding gender and sexuality, where the person cannot be able to associate with the gender that they've been born with. And cognitive disorders, for example, they have problem identifying something or think logically, and so on. Disorder in terms of elderly or aging, because when we getting older, and some of the nerve and some of the physiological things in our body is also growing older. This may affect our memory, and so on. So we may experience some disorder when we're getting older. It's depend on the genetic as well. So another abnormal behavior in childhood and adolescence, especially if you have genetics in your blood, this may also happens. Other disorder may happens in terms of abnormal behavior, and also other disorders. So work dysfunctional. When we talk, we are moving to the topics regarding dysfunctional at work. That means employees cannot be able to function properly and appropriately at work. So this is more associated with the work-related behavior involving emotion, thinking, and perceptions that influence the work outcome. This normally often stress-related issue. This also may be caused, work dysfunctional may be caused by personal characteristics such as personality traits. Personality trait may contribute to how you be able to perform or not at work. So for example, those who have conscientious personalities may be able to perform well at work, and those who have neuroticism or emotional unstable may have problems performing at work because of their personality traits. and also work attitudes, illnesses, or interaction between employees and their work environment. So those who cannot be able to interact well within their environment, work environment, also may experience some work dysfunctional.